afternoon, welcome back. This is Saima. If you haven't met me before, I'm a nurse from Southeast England. In today's video, I'm going to tell you a simple common question someone asked me about. They said what to do if I have a conflict with the patient. So you are a nurse or a healthcare support worker, you have a conflict with the patient. What should you do in that scenario? Okay, this is all we are going to talk about in this video. All right, I'm a nurse, Saima. I'm working here in the UK for the past 3 years, and I provide information about UK nursing, how to become a nurse here in the UK, how you get accommodation here in the UK, how to become a support worker. I provide information about interview tips for carers, for nurses, and for band 6 nurses as well. So also about my routine here in the UK, what we do here, cost of living, each and everything, UK updates, immigration updates, and each and everything you can think of, you will find that video here on this channel. So consider subscribing, please. Okay, if you're a returning viewer, thank you so much for coming back. Let's talk about today's topic. And as I said, if you are a carer, you're a nurse, and you have some argument, you have some issues with that patient, what is conflict? In short, we talk about conflict, a serious disagreement, serious argument with the patient or with someone. It's called a conflict. When you are at work, if you have any argument or serious conversation and they are continuously disagreeing with you, that is called a conflict. Okay, so if you don't know what is conflict, you can also call it a clash, or you can also call it a serious discussion, contrary discussion. Okay, so this is conflict. Now if the conflict has happened, you cannot do anything, can you? But there are other things, there are some points, there are some tips you can consider, and you need to work on that. Okay, first of all, you need to have good communication skills. Why is it important? Because you can change your words while saying thing that can be offended to someone. Like if you have to say something, you can say it in a positive way. So if you have a good communication skills, you can say that thing differently in order for that person to act differently as well, isn't it? So okay, we'll not talk about it. In short, you need to have good communication skills. And also, if you have had conflict already, now what should you do? First and foremost, you need to report it to your supervisor or your in charge or your manager. Okay, whoever is senior there, you need to report it to the manager or to the in charge of the shift. Tell them that I just came to the shift. If that person is still there or if that patient is still there, I'm so sorry, I cannot work with that patient because I had a conflict, I had some issues. And then you can tell the story behind that as well if you have the time. Okay, so now you have reported that to the supervisor, and if supervisor agrees, she'll put you somewhere else. If not, if you still need to work on that particular patient, if you still have to work in that ward or in that area, you can just what do you call it, just behave professionally, and that's it. You don't need to do disagreements or arguments again with that patient. Okay, they change your shift, or if they change your department, well and good. If they don't, you just need to do what you have to do and act professionally. Normally you should act professionally. What I mean to say is, don't make any drama again, don't disargument with that patient. And if you were right, you can explain it to the patient on that time when the argument is still ongoing. Okay, but if you start it again later on, it can be a big deal for them. Says don't say things again sarcastically. I know a lot of people, they do that, like if they're talking to another person and saying the things again, it can lead to a problem again. So just leave it. If it has happened, leave it aside. What you have to do is you have to document all those things, what they mentioned and what you said. Okay, document that in that notes. Patient got upset, why they got upset, what did you say and what did they say, and I have already reported to the supervisor or the in charge. In this case, documentation is very, very important. Okay, if you don't document, maybe it can be considered against you. Why it can go against you is because in the case, if patient makes a complaint and says this carer said this to me and I want to make a complaint, if you have documented all the things, what you said and what the patient said, it will be all right. And if investigations happen, if your manager or your in charge, they have to look through the case again, because when they get a complaint from a patient, when they get a complaint from the higher authority, and if they need to do investigation, they'll go through everything again. They'll check your documentation, they'll speak to the patient, they'll check your documentation, they will speak to you as well. Okay, so if you have documented everything, if you made sure that everything was written clearly, okay, then you will not be penalized for that. There will be no problem against you. Okay, so if you did not document it, you don't document it, and something happens, patient makes a complaint, investigations happened, your manager, your supervisor, they check everything and they find out that there was no documentation at all. If you don't document anything and investigation happens, this case may go against you, and it's not good, honestly. All right, so try to document each and everything. If something happens like that, make sure you write each and everything, whatever is said and how you say it, how the patient said it. Okay, so because it will be quite helpful. The other thing you can do is you can write what do you call it, write a statement. Okay, if you feel like this argument or this conflict is very serious and you need to document it, you need to highlight it to the manager in writing. Okay, you documented it in patient notes, that's fine. Okay, what the other thing you can do is you can write a statement, write the patient name and patient's NHS number. Okay, write that and then document and start writing the whole story, okay, to your manager. Okay, so you're writing this email. Let's say patient name is Ann Smith, or the patient name is Simon Adim. Okay, and NHS number is documented, and on today's date, I would like to highlight that patient was very aggressive, or we started having an argument. And what was the argument? Each and everything what patient said, exactly same wording what you said. Okay, and what you did about it, and you can just send that email to your manager or to your supervisor. In why it is important, because if something happens afterwards, if patient makes a complaint, if there is any case against you, if there is any problem against you, if there is any thing rise up, if there is anything, if there is any problem, then they can go to that letter and they can search about that patient. So if with that email, it will be easier for them to respond to the query or to respond to the complaint. Okay, then they don't need to ask you anything. If they need to ask you, if you're still in the employment, they can ask you. If not, they can just go through the email, read in the email what has happened and why it was happened, and what did you said, what did you say, what did the patient said, what did the patient say. Okay, so if everything is in writing, it will be very easier. Okay, so this is for the nurses mainly, but for the carers also, they can follow the same procedure. All right, so what I said in short, there is a conflict between you and the patient, and you have documented each and everything. Patient is still there, you don't want to work in that department. Tell to your supervisor or your manager, I'm so sorry, but I cannot work here, I have some problems, I have some conflict with this patient. So they will change your department. Okay, for that shift maybe, because sometimes patients, they stay only for 1 day or 2 days. If they are there, they'll put you in another room. Okay, so this is the first thing you can do. You have reported that, you have documented that. Okay, so it will be taken into consideration. Now, What are the other things I said is you need to have good communication skills, and I would say don't let it happen. Don't let it happen. Why I'm saying that? Because if you put yourself in patient shoes, they are in difficult situation. They have some kind of disease, that's why they have some kind of problem, this physical issue or mental issue, that's why they are in the hospital. If you put yourself in patient shoes, if you think about it, if you are a patient, think about it. If you are a patient, you are in the hospital, and any nurse or any carer or any support worker or any doctor misbehave with you, how would you feel in that case? Okay, so same thing is the patient. If you as a nurse, as a carer or a doctor, speaking rudely to the patient, or misbehaving with the patient, or having conflict, having arguments with the patient, it's not nice. It's not nice feeling to work. Okay, you cannot work there for the whole shift. You would be burning hot all the time. You'll be upset, you'll be angry, or this behavior is not acceptable. And also with this behavior you won't be able to help other patients. You won't be able to work comfortably with other patients, because I know the feeling. And if something happens, like if I have any argument with someone, I cannot work properly. I feel there is something wrong. I cannot work properly. I cannot feel comfortable working in that particular room. Okay, so I would say you should have good communication skills. And if you have good communication skills, if you are a professional, if you know how to talk to the patient, if you know how to use open-ended sentences or closed sentences at the right time, okay, you will not have any conflict. You will not go to that stage. All right, so if there are, I know it's not easy. Sometimes mistakes happen, sometimes it happens, like we go to that point that there is a conflict. It can happen, and you never know what happens, because sometimes if patient has any mental issue or mental health problem, and they don't know what they're saying, if they have dementia, or if they have any other activity syndrome, or anything else, any other kind of hyper problems, what do you call it, if they have Alzheimer's or any other kind of disease, and they don't know what they're saying because of their short memory. So if they don't know what they're saying at that time, you shouldn't be wasting your time arguing with them, because they don't know what they're saying. After a few minutes they will not remember anything. Okay, so if you know how to handle the situation, if you know how to use your if you know how to use how to work with the dementic patients or Alzheimer's patients or patient with mental health issues, you would be able to handle that situation wisely. You would be able to handle that situation professionally without making any conflict. Okay, all right, and I'm sure you got my point, and you got what I'm trying to say. I'm not a teacher, but I try my best to explain it as much as possible, as easy as possible, because I know it gets difficult, it gets hard, especially with working with the patients, with the elderly patients. If they have dementia or Alzheimer's, they don't know what they're doing. But we as carers, we as nurses, we as support workers, we know what we're doing, and we know their situation, what situation they are in. So it's very, very important for you to understand their situation, their mental health, their physical health, before you say anything. Okay, and if something happens, I've given you the answer for that also. That's it for today, guys. I hope you liked this video. If you did, please let me know in the comment section. If it was helpful, you can share it with your friends and colleagues, and I'm going to see you in the next video very soon. Thank you so much for watching. Take care. Bye bye. God bless you all.